All right, welcome everyone to IPA's webinar on promoting early childhood development, recent evidence and policy lessons. We're really excited that you could join us, and we look forward to discussing both some recent research findings, but then also thinking about how to interpret them in context and consider policy applications. We're really excited about our panelists today. So just to quickly introduce everyone. So we're going to start with Elisabetta Aurino, who's going to be presenting some research from Ghana. And then we're joined by IPA's policy advisor, former member of the Ministry of Education in Ghana, Cynthia Bosumtwi-Sam, who's going to be discussing how to interpret those research findings from a policy perspective. And then Emma Naslund-Hadley is going to present some research from Panama. And then we're joined by Horacio Álvarez Marinelli, who's going to discuss how to interpret that research from Panama within that context and think about policy applications. And then just to introduce myself, my name is Sarah Kabay, and I am the Education Program Director for Innovations for Poverty Action. And for those of you who might not be as familiar, Innovations for Poverty Action is a research and policy organization. And we're often best known for our work in randomized evaluations, right? So we are the largest implementer of randomized evaluations in the development field. And so our commitment to high quality data collection and the most rigorous approaches to conducting impact assessment. And we're able to do this through our 22 different country offices, the more than 600 researchers in our network, and our over 700 partners. And we have 8 different program areas. But we'll talk about this a little bit later today. Early childhood education is definitely a key priority within our education portfolio, but we also recognize that early childhood development is very intersectoral, and so we think about the connections across program areas and sectors. But just to highlight, Innovations for Poverty Action has 17 years of experience generating evidence and working to move that evidence to policy. And so that's something I want to highlight a little bit here in relation to our most recent strategic ambition, really emphasizing that we're more than just RCTs. But here we see 3 key focuses of IPA at this point, to work to develop stronger evidence, to share that evidence strategically, and then to do the really in-depth work of equipping decision makers to be able to use that evidence on a regular basis. And so we're really excited to have this webinar join some of our other webinars here, working to try and share evidence strategically. We'd also just like to use this moment to highlight one of IPA's newest initiatives. And so this is IPA's Recover initiative. So research for effective COVID-19 responses. And this has 3 main components. So the first is that IPA has been conducting a Recover survey in, I think at this point, we're now in 10 countries. So looking at some key data and information that might be most useful for the second line of work, which is advising governance on evidence-based approaches. So thinking about how data and information can help guide decision-making during this particularly challenging period of the COVID-19 pandemic. And then finally, we've created a global hub to try and centralize research and policy lessons and share not only the research and work that IPA is doing, but that our partners and many other organizations are doing, and try to connect and build and collaborate. And so all of this work is shared on IPA's website. So we have that address there at the bottom. And so we really encourage you to look into that and connect and become a part of the Recover initiative there. But then just to return to our goal for today, right? So one of the key motivating questions behind today's webinar is how can researchers collaborate with practitioners and policymakers to ensure children have opportunity to reach their full potential? So just to quickly outline our webinar today. So we're going to start with Elisabetta, who's presenting some research on the connection between food security and early childhood development in Ghana. And then our policy discussant, Cynthia, will respond to that research and briefly discuss how to think about it and how to make it relevant for policymakers and other decision makers. And then we'll have our second presentation by Emma Naslund-Hadley, who's going to be presenting some research from Panama on an intercultural bilingual preschool mathematics program, so implemented within indigenous communities in Panama. And then our second policy discussant, Horacio, is going to discuss, again, how to think about that within that particular context, how to learn from it and connect it to the work of policymakers and other decision makers. Then we will open up the webinar to question and answers. So feel free to type in your questions at any point in the section on your screen. And I will be moderating. I'll try to get to as many as we can, and then I'll direct some of those questions to both of our presenters and our policy discussants in a Q&A panel session at the end. So I just wanted to keep that introduction very brief so we can get into the content. So I'd like to introduce Elisabetta, if you want to share your screen and start with your presentation from Ghana.
Sure. There you go. Okay, good morning, good afternoon, everyone. It's a real pleasure to join this conversation, and thanks a lot to IPA for organizing this webinar. I'm looking forward to the discussions. So today I'm gonna present some joint work with Sharon Wolf and Edward Sinigo on food insecurity in early childhood development, looking at longitudinal evidence from Ghana. So let's start. So first of all, let's define food security. Food security is a key human right and a key sustainable development challenge, as underscored by the SDGs, SDG 2 precisely. And it's usually defined as a situation in which all people at all times have access to sufficient, safe and nutritious food that meets their dietary needs and food preferences for an active and healthy life. So this is the standard definition of food security by FAO. And this definition really underscores the complexity of the concept of food security that covers many different dimensions, ranging from availability of food to access of food, the nutritional properties of these foods, and the stability of this access. But in this specific context, we will focus specifically to the extent to which households can have access to enough and nutritious foods for their basic nutritional needs. So we will have a very narrow, if you want, definition of food security for for this paper. So there are four main theoretical channels through which food insecurity, as we just defined it, may shape early childhood development trajectories of children. The first and probably most obvious link is through nutrition and health. So if households have struggled to get enough food or quality food, nutritious food, there may be nutritional impairments for children. And we know from a very, very extensive literature that malnutrition, especially in the early years, usually they talk about the first 1,000 years, is really critical to set up children for their long-term developmental trajectory. So this is the first channel we should take into account when thinking about this relationship. The second channel relates to other complementary ACD investments. So if we know from research from poverty that the households usually prioritize the acquisition of their food needs in their budgets, and they may struggle then if they already have challenges with their food security. They may struggle to also access other inputs for early childhood development, not only resources in terms of materials, books, games, and so on, but also the time that a caregiver may spend with their children in developmental activities, because maybe they're involved in many different jobs they have a limited bandwidth to really provide their nurturing care environment that their children would need to flourish. The third channel is related to this one, and it relates to the quality of the caregiver and child interactions. In fact, we know from research from both high-income countries as well lower income settings that caregivers in food insecure households have mental health issues, may have mental health issues, or they may feel more anxious or stressed, and in turn, this may shape the way they interact with their own children. And the fourth channel relates to the children themselves. We know that children are not passive actors in face of food insecurity. They know very well the food security situation of their households since quite a relatively early age. And when they're older, they even act upon this situation. And so children themselves may feel stressed or anxious. Or on the other end of the spectrum, they may be more fatigued or lethargic. So in turn, this may affect the way they interact, not only with their parents, but also with their peers or early childhood educators. So we know that the greatest burden of food insecurity is in sub-Saharan Africa and South Asia. In this specific paper, we will focus on Ghana. And we also know that the greatest burden of impaired childhood development is also in sub-Saharan Africa. In this case, poor development is measured as a failure to meet key cognitive and psychosocial health milestones. So we know that here we have the greatest burden in sub-Saharan Africa, but the evidence on this relationship is really, really scarce, which is kind of surprising if you think about it. And in fact, most evidence on the food security and childhood outcomes in general comes from the US, where since the late 80s, there is a rich tradition of measuring routinely food insecurity in household survey. And the evidence with regards to early childhood development shows that growing up in a food insecure household predicts some behavioral problems and also lower academic and psychosocial health. In the context of low and middle income countries in general, most evidence either focus on looking at the relationship between household food insecurity and diets and nutrition in the early years. So especially in the early years, we have completely a knowledge gap with regards to other dimensions of child development. And existing studies that do look at other dimensions of child development, I'm talking about education, learning, psychosocial health, focus on adolescents. So this ECD, we have a huge gap there. And surprisingly little is known about exposure to household food insecurity on children's development in the early years. So basically in this paper, we start to fill this gap by using quite a unique from children and their caregivers over time in order to start to think or start to document the longitudinal association between household food insecurity and trajectories of child development, taking advantage of the multiple dimensions of child development that are tracked in this data set. It's, as I mentioned, we are set in Ghana, and Ghana is a particularly interesting context to look at this question. So as compared to its neighbors in the region, Ghana is not as food insecure, but still we have 1.2 million people that are classified by the Ghana Statistical Services as food insecure, plus 2 million additional people that are considered as very vulnerable to extreme food insecurity if a shock occurs. We have relatively high levels of child stunting, which is a critical indicator of malnutrition in childhood, especially before 5 years, with wide inequalities across the countries. And 1 out of 3 children in Ghana do not meet basic developmental milestones. We know that stimulation in the early childhood period is generally low, stimulation at home. But on the other hand, we have a very interesting policy setup because Ghana is one of the countries, one of the pioneers in Africa with regards to early childhood education. It was one of the first countries making early childhood education compulsory. And so we have among the highest rate of enrollment in ECD education, almost universal primary schooling, plus a school feeding program that, as you can see in the picture, targets the most vulnerable districts in the country. So going to very quickly to our study results, just a little overview of our methods. So as I mentioned, we use this sample from the Quality Preschool for Ghana study. This is a randomized control trial that was done, started in 2015 for looking at early childhood education. But later it kind of transformed into a sort of longitudinal study as children were followed over time, and we are planning to go back in the field in the fall to keep following these children towards the end of primary school. So children were first tracked, children and their caregivers, when children were about 4 to 5 years. And in this particular study, we used 3 waves of data collection until basically following children until the age of 7 and 8 years. As I mentioned, this is a very rich data set. We have both academic outcomes, cognitive and socio-emotional development outcomes. So very, very nice different span of competencies. And we standardized those outcomes to have a mean equal to 0 and a standard deviation of 1. So how do we measure household food insecurity in this case? So we focus on access, and specifically we use this household hunger scale. This is a scale that was devised to measure food insecurity, acute extreme situation of food insecurity in low and middle income countries. So it's very nice because it's a validated scale that works very well in different contexts. And we classified the household if it was in any round food insecure, because the scale identified either a situation of moderate or severe food insecurity. In this research, we asked ourselves whether it made a difference, whether a child is exposed to food insecurity once, or if he's exposed or she's exposed multiple times. So whether she lives in a household that is persistently food insecure. And so beyond just categorizing the occurrence of food insecurity at a given point in time, so whether the household in any of these 3 measurements was ever food insecure, we also categorize further households whether they were what we call transitory food insecure, which means that they were food insecure in just one wave, but then they recovered, or they were persistently food insecure, which means that they were food insecure in 2 waves or all the waves. Okay, we have quite a limited of this latter persistent food insecure households is 3%, and at the end of the talk I will briefly maybe spell some reasons why. Anyway, since we have limited time, I will just jump to the findings. And the first finding, the first take-home message that I would like you to take home, I mean, you're already home, but the first idea that I would like to pass you is that when we look at ever food insecure household, children that experience at any point in time food insecurity at home had lower academic and cognitive outcomes. So this chart plots the regression coefficients from different multivariate models that look at these outcomes, these different outcomes. And this is the coefficient related to whether the household of the child was ever food insecure. We control for a bunch of other things like child and household characteristics, plus the baseline value of those outcomes, which should provide quite a robust estimate of this outcome, although we cannot claim causality. And we find that actually kids that were ever in food insecure households have lower literacy, maths, and short-term memory outcomes. We didn't find any significant effect with regards to socio-emotional development nor self-regulation. Now I go to the second key finding that relates to what I was just discussing. So it doesn't matter if you're just food insecure once, or you need to be consistently food insecure in order to have lower outcomes. And basically this question, these are the results of the models that look at these questions, in which the blue bars look at transitory food insecurity, the coefficients for transitory food insecurity as compared to never food insecure, and the orange bars are persistent food insecurity as compared to never. And we find that actually quite surprisingly, just being once, one time food insecure at home predicts lower maths, short-term memory, and self-regulation outcomes. Whilst only for literacy, we find a moderately significant effect or association with persistent food insecurity. So just going to the last slide, just to summarize. So this, to the best of our knowledge, this was the first study examining the relationship between food insecurity at home and early childhood development outcomes in the kindergarten and early primary years. And when we look, and we find quite a variation in the results, not only in terms of the outcomes that are predicted by being food insecure at home, but also by the degree of persistence of the household food insecurity. And both of these are understudied topics. And so I really I would be super excited to see more research on this topic. We find that only for when we look at the comparison between being only once food insecure vis-a-vis multiple times food insecure, we found that only for literacy what mattered was a persistent exposure to food insecurity, whilst for the other outcomes, maths, memory and self-regulation, even being food insecure once, was mattered for later outcomes of children. And this was a finding that I found in a different study that I conducted in Indian adolescents, in which for maths, again, we find this effect, this association between food insecurity. And also, if we look at the literature that looks at school feeding or school breakfast, on memory, we find that kids that receive school breakfast, so they're not hungry, can have a better performance on memory. Just a word about the validity of these findings. This is a sample from the Greater Accra region, that is the most affluent in Ghana, although the children of this specific sample come from the most disadvantaged parts of this region. But still, it would be interesting to see in a rural context how findings would change. Also, our measure of food insecurity focused on extreme hunger. So it would be interesting to see how results would change if we look at different variation in the intensity of food insecurity. And also the school meals program in Ghana, we found that is effective in promoting child nutrition and educational outcomes. So it may have mitigated somehow, we can speculate, it may have mitigated the overall effects of exposure to food insecurity. And then, I mean, just 3 words before Cynthia will talk about the policy implication, especially for the COVID crisis. We know that kids don't have school meals because now are at home. So this big safety net is not available anymore. We may expect a strong increase in food insecurity because, especially in urban areas, because it's a large shock. And so I'm really looking forward to the discussion about ideas of social protection or other measures to really protect children from the detrimental effects of food insecurity on their development. So this is a paper that has been published, it's open access, so you're welcome to download and read. Thank you so much.
Great, thank you so much, Elisabetta. That was wonderful. It's really exciting to hear. And now I think we'd like to turn to Cynthia to discuss the policy implications. Cynthia, could you try to speak closer to your microphone? We can't hear you. Apologies, Cynthia. Sorry, we still can't hear you. Could you speak as close as possible to the microphone?
So there is a need for governments to adopt the right things to the issue of food and nutrition insecurity among especially village children and also the general population. We have the livelihood and empowerment against other programs.
Sorry, Cynthia. Could you speak closer to the microphone? We can't hear you, or maybe you have. Yeah, sorry, we're having trouble hearing you. Mm-mm. Okay. Yeah, can you speak? I think we...
Can you hear me now?
Perfect. Thank you so much.
Okay, sorry. I was talking about the Ghana school feeding program, which provided one hot nutritional meal for children. But since schools are not in session, it is not running. And government needs to adopt a right-based approach to providing meals for children and also families that are food insecure. We have the LEAP, which is the Livelihood Empowerment for Poverty, which provides cash transfers for vulnerable families, families with single parents or orphan and vulnerable children and elderly and people with disabilities. But this is a cash transfer that is given to the families. With the COVID-19 and the lockdown, government provided some food staples for families during the lockdown. But since the lockdown was lifted, these food supplies have not been forthcoming, and yet people have lost their livelihoods. Some people have been laid off work, etc. So there is a need for greater support. The other safety net intervention that government gave during the lockdown was to pay the utilities, electricity and water. Poor households had 100% payment of their bills for 3 months, and then all others had a 50% reprieve. But we are now beyond these 3 months, and there's a need for government to extend these safety net interventions so that families can have some extra money that they would have used to settle SEC bills to use to feed their children. In the long term, we need data on the nutritional needs of especially school-age children, and we need a multi-sectoral approach in targeting the problem. So Ghana is basically an agrarian country, and we do a lot of farming, but it's small-scale farming. So there's the need for government to support these farmers so that they'll be able to provide food in large quantities to feed the population. And we know that with demand and supply, when enough food is produced, then the prices of food stuffs are likely to go down. We also need the Ministry of Health. Although they are doing a lot for school-age children, they need to do more when it comes to the health and nutritional needs of these children. There is a lot of vitamin supplementation going on in Ghana, but it has to be sustained in ensuring that we prevent the malnutrition with food, but also we ensure that children are given some kind of supplementation. Also, the education sector needs to provide very stimulating learning environments within the KGs and the primary schools so that we can stimulate the cognitive development of the children. There's some research going on in how to improve upon parental engagement. So parents in some of the KGs around Ghana, especially in the urban and rural areas, have been given some kind of orientation in how to help the children when they come home and stimulate their interest in play-based activities. If we are able to expand this, then we develop a bridge between the school and the home, or the ECD center and the home, and provide parents with the opportunity to help the children stimulate their learning. And when they come back to the school environment, then we have a very rich learning environment. So generally speaking, this is a very interesting study, and I hope that the longitudinal study will continue so that we know the outcome of these things on the children going forward. But then we need data. As Betta said, this research was done in and around Accra. So we need how it plays out in the rural context and other geographical areas of Ghana so that a holistic decision can be taken on it. Thank you.
Okay, great. Thank you so much, Cynthia. And again, we'll return to questions once we finish all the presentations, but maybe now we can move to Emma's presentation from Panama.
Good morning, everyone. Good afternoon to those in other parts of the world. Hope you can see my screen now. Imagine that what you count determines how you count. Imagine that you count children by saying 1 child, 2 children, and 3 children. But when you count oranges or balls, you use an entirely different numbering system designed specifically to count round objects. And when you count dogs, then you use yet another numbering system designed specifically to count things with 4 legs. Sounds crazy? Not if you're a preschool student in Panama's largest indigenous community, the Ngäbe, the Comarca Ngäbe, because these students are part of an IDB-financed project that teaches kids bilingual mathematics and intercultural bilingual mathematics, or ethno-mathematics. These children are learning visuospatial reasoning, how to recognize mathematical concepts in their everyday lives, and 14 different ways of counting, among many other things. At this point, you're probably going, oh my God, this is completely nuts. We know that Latin American kids are among the world's worst performers in mathematics, and now we're wasting valuable lesson time in teaching them some ancient math system. But bear with me and I'll explain the logic behind this project. You're probably well familiar with the benefits for kids of being raised bilingual. There's numerous studies showing that if you're raised bilingual, you have greater creativity, you're better at multitasking, and you score higher on cognitive tests. But how about being raised binumerical? Anthropologists have long argued that if you're raised by numerical, you're going to be better at math because you learn different types of math. You learn to see mathematics in different ways. They've also argued that you learn more about your culture if you learn ethno-mathematics. But so far, or before Jardengo, all projects of ethno-mathematics were anthropological studies, very interesting, but very small, looking at 1, 2, or maybe up to 5 kids, but not bigger. So that's the logic of this project. We wanted to study the benefits of learning bilingual mathematics and ethno-mathematics. And the project was, it's an IDB project, but we had generous funding from the Japanese Trust Fund of the IDB. They funded this project. The Organization of Ibero-American States and the Ministry of Education helped with execution. And this is really a project that's owned by the Ministry of Education in Panama, MEDUCA. And IPA, Innovation for Poverty Action, did the external evaluation of the project. So this was really like a project with lots of participating organizations. The project had a bilingual part that where simply you did Western math in Ngäbe and Spanish, and the intercultural mathematics part where you learned not only Western math but also Ngäbe ethno-mathematics. And the model for teaching this, we picked an interactive radio approach that we had used previously together with the government in Paraguay. And it was in a project that was recognized by the government of Finland in 2017 as one of the 100 most inspiring and innovative education programs that year. So we used that approach because when you use interactive radio, then we were able to bridge the problem that many of the teachers who teach in La Comarca Ngäbe in Panama, they don't speak Ngäbe and they don't know ethno-mathematics. So by using these radio lessons, then we could bridge that gap and bring ethno-mathematics and bilingual mathematics to classrooms, even though the teachers might not be Ngäbe speaking. The evaluation design, of course, was very rigorous. A randomized control trial that IPA helped design. We had 3 groups. We had a bilingual preschool math group where they got Western math in Spanish and Ngäbe. And then we had a second group that was intercultural bilingual, where they had Western math and ethno-mathematics in Ngäbe and Spanish. And we had a control group where they got traditional preschool math. All groups covered, or tried to cover, I should say, the Panama preschool math curriculum. And what I present here, it's then I'm going to present the results on the first 2 groups together, because really, even though we tried to implement the entire Panama preschool math curriculum, the 200 class days that kids are supposed to have in Panama, they really seldom happen in this area of the country. So class time is really limited. We had designed 108 math lessons for group 1 and 108 math lessons for group 2 with audio lessons. But first year in 2018, we implemented only kind of 25% of that. In the second year, we managed to implement a bit over between 30 and 40% of that in most schools. Some schools we implemented much more, but in some schools basically almost nothing. So it's on average like in over 30% the second year. So so the implementation was quite limited. So I'm presenting then groups 1 and 2 together and contrasting that with the control group, which received traditional preschool math. The instruments we used, we had questionnaires for teachers, parents, and directors. And then we had a standardized learning test for kids. And the standardized learning test for kids, it was based on the early grade math assessment and early grade reading assessment, but preschool versions of those that IPA had helped us design earlier. We've now used it, I think, if it's in 5 countries, maybe more. and then also a math anxiety test, which really is a recognized instrument for primary level. We have adopted it and used it now in 3 countries to measure math anxiety at the preschool level. We also developed the ethno-mathematics skills test with the help of IPA, also tests of cultural values, since that's one of the things that anthropologists have long argued improves with ethno-mathematics. We also measured oral comprehension of Ngäbe and also oral comprehension of Spanish, actually, that's in the EGRA test, and then also perceptions of math. I'm not going to present all this because I don't have time for that within the allotted 10 minutes, but this is just one question to show you a question from the ethno-mathematics exam, where Kwati is the numbering system for round objects. So here we're asking the kids kind of to identify which of these 2, the tomato or the carrot, which one they would use the Kwati, the numbering system for round objects. So those are the type of questions that we ask. The kids are, of course, 4 and 5-year-olds. And then going on to the results then from 2018 and 19. Then we had in 2018, where there were more limited implementation, then the effect was a 0.12 standard deviation. So that's quite decent effect, particularly given how limited implementation was. In the US, what a kid learns typically in 1 year of math instruction is 0.4 standard deviations. So 0.12, that's than what the treatment group learned additionally compared to the control group. So it's a quite decent effect. And that really increased, even though implementation didn't increase that much. Just those additional lessons in the second year really increased the impact of the project on Western math skills. Also in ethno-mathematics, we had a strong impact of 0.23 standard deviations and 0.24 standard deviations compared to the control group. And that's, of course, it's really strong because it's thinking again, of course, we don't have any data on ethno-mathematics from other countries, but given that typically you learn 0.4 in 1 year of math instruction, then here you have one year of ethno-mathematics instruction, but really it was, even though it was implemented supposedly 1 year of lessons, it was limited, as I mentioned. In terms of other results, then we didn't have any impact on Spanish comprehension and Ngäbe comprehension. And that really points to that this is a math project, and it really needs to be complemented with an as high quality project for early literacy skills for preschoolers in this area of the country, in the Comarca Ngäbe. That's really needed because the skills are very low. When it comes to cultural identity, we did have an effect of 0.14 standard deviations and 0.13 the second year. We also had a qualitative evaluation where we, or IPA actually, recorded with video recorded lessons and then coded those lessons. And some of the advantages that we found was that the kids and teachers really had fun with the math lessons. They were really engaged when we contrast that to the traditional math lessons, because the lessons are full of singing and using the body and learning, so they had lots of fun. Also that the lessons were implemented as intended, and there was like a system that independent of what teacher implemented, it was kind of consistency across teachers. We also saw a greater parental involvement when you had a focus on ethno-mathematics. Challenges is that clearly it's hard to cover the entire curriculum, preschool curriculum in 1 year. There also were challenges with the pronunciation of the Ngäbe language. Just briefly, some concluding remarks before giving over to Horacio. So we know that Ngäbe increases children's Western math skills and ethno-mathematics skills. So that really points to the need to scale these type of interventions. It also increases students' knowledge of the Ngäbe culture, and which I haven't presented here because of lack of time, but we also actually had an impact on teachers' knowledge of Ngäbe and ethno-mathematics. Horacio, I turn over to you.
Thank you, Emma. I don't know if, can you hear me?
Yes, I hear you perfectly.
Great. Thank you very much to our colleagues for organizing this meeting. And thank you, Emma, for the presentation. This has been really one of those programs that you can say it will make a difference for the future of children, not only here in Panama, but in the region. In the case of the program that was based previously, it was called Tiquichuela, like Emma mentioned, in Paraguay. You see that children learn more, children are more engaged, and children are learning based on their culture. And this is not only important for Panama and Paraguay, for other countries that can use this methodology in Latin America and the Caribbean. For example, Guatemala, Peru, Bolivia, that also have populations where the main limitation to access quality education is that the teachers do not speak the language of the communities. So this study really helps us shift the conversation, and in terms of policy, gives us very powerful information in our dialogue process with our counterparts at the ministries as to how to implement effective programs to reach basically usually underserved populations like indigenous populations. But it also reminds us that that technologies that we had discounted before even the pandemic, the use of radio instruction, in this case we used interactive audio instruction, but the use of radio for hard to reach communities should be vamped up again. And all this push during the last 20 years for the use of technology, there are some technologies that are more effective to reach underserved and underprivileged populations. And this is one case that reminds us that old technologies that come from really more than a century ago can help us in teaching children when they're structured and when they're high quality, like the program that Emma just presented. In the case of Panama, we are using the results of this program to expand it not only to the Ngäbe community, but to other two communities, large communities here in Panama, the Ngäbe and the Gunas, which are another, there are seven indigenous groups in Panama. So this would be more or less, we would be covering 95% of the indigenous populations by expanding this program and adapting it to Kuna and Ngäbe. And we're also expanding because of the success of this program, the use to teach Spanish as a second language to children using interactive audio instruction. And Emma mentioned during her presentation the fact that most of the teachers that are assigned to these communities do not speak the language of the community. That's one main area of concern always in policymaking, in teacher selection processes in Latin America. But even more so when the communities have very few people who graduate, are able to graduate and to make it to become teachers because of the language barriers, because of the quality of education. So one idea that came out of this program was, how do we, in the earlier grades, how do we bridge the gap that we have currently with teachers not being able to teach children because they don't speak the language of the community, use of interactive audio instruction. So this is like a current application of like a very good study implemented by the ministry, by people from the Organization of Ibero-American States, with funding from the bank and very close monitoring by our colleague Emma, and a very robust evaluation that allows us to make a case to use this and expand high quality interventions to support the most deserving and underprivileged children. So thank you for the opportunity to comment on this.
Okay, great. Thank you so much, Horacio. So I'll invite all of our panelists today to turn on your videos and we can open it up for a discussion. And so I thought I'd just start us off by having a question that I think is relevant for all of our panelists, which was something that came out in both presentations. And this was, I think, just what Horacio was talking about the unique challenges of reaching particularly disadvantaged populations or particularly marginalized populations. So I think that was this important theme, like looking at Betta's presentation about, only 3% really experienced the severe food insecurity, but then a slightly larger percentage had at any point experienced food insecurity. And then for Horacio, the population that Emma's work was looking at is a particularly disadvantaged population within Panama. Some of the initial work or research we're seeing right now during the pandemic is to think that inequality is only going to get worse during this period while schools are closed. So I was wondering if any of our panelists wanted to talk a little bit about this and what you think could be really helpful for different organizations and governments moving forward to how to address inequality at this particularly challenging time.
Perhaps I can comment, like like Horacio mentioned, interactive radio really has promises to address inequality in these times of distance education, and because you can use the radio. We have intentions of transmitting it by radio in Panama, and also the program that we mentioned in Paraguay, Tiquichuela. For now, what we've done is that we've, together with the Ministry of Education and the Organization of Ibero-American States, we've printed materials with for parents on how they can kind of guides for parents that we already had produced before on how they can work on ethno-mathematics and mathematics at home, and we've distributed those printed guides to parents. The problem that we encountered with the interactive radio transmitting it to the households was that many of the households did not have radios. So we would to actually use the radio transmission, we would then have to also distribute radio. So we're looking at that now, if that's something we can do. But for now, then we just kind of print it out and are distributing in the comarca to parents information how they can work on interactive radio, or use the program without interactive radio, but doing things at home with printed materials like math stories and things like that. So that's how we're using it now in times of COVID for now.
Yeah, that sounds great. That's definitely something we're seeing, how important the home learning environment is and how to provide maybe additional resources or support for families who don't already have those resources or aren't already engaging in these types of activities. Yeah, Beta, do you want to comment?
Sure, no, I agree from an educational perspective. What the other panelist has just said is I completely agree. I would also add that from a social protection point of view, so what Cynthia and my presentation was hinting a little bit towards the end. So thinking about programs like school feeding that obviously now cannot run in school, but still schools could be used as a platform, for instance, to distribute food rations for children that were previously targeted by the program. This is done in some parts of the world, in Latin America. I know some example in Uruguay and in India. So this could be doable. Or maybe easier from a logistical perspective, scaling up existing cash transfer program to support families. So for instance, Cynthia mentioned the LEAP in Ghana, but now cash transfers are pretty omnipresent around the world. So thinking on how cash transfer could be scaled up during the emergency. And also I think after, when school reopen, to make kids transition back to school, because we know from previous shocks that after such large macroeconomic shocks, as you mentioned, girls or other most vulnerable groups like poorest children, children from indigenous community are the ones that are kind of having the longer term impacts, because maybe they drop out from school and don't return when schools reopen. So thinking about some incentives in schools, like in-kind take-home rations, for instance, food take-home rations, or some incentives provided by cash transfers could be a way to make them tackling these potential inequalities that may become larger. Thank you.
Great, thank you. So then I think that's actually a great introduction to another question that I'll direct towards Cynthia and Horacio. This is something, Cynthia, you mentioned in your remarks about the need for early childhood to be multi-sectoral, but then also some of the challenges in realizing that. And so I think Elisabetta's example of school feeding programs, I think, is really interesting, where traditionally the education sector would provide school meals, but now that schools are closed, is there the possibility to pivot or think about how to involve other types of interventions that are maybe delivered by social protection or other sectors to be able to address this? Cynthia and Horacio, I was wondering, from this policy perspective, have you seen some of this collaboration, or what do you think could help in this moment to think about how different sectors and ministries or departments could coordinate to try and address, you know, children's holistic development?
Yeah, thank you. The Ghana School Feeding Program is actually not hosted by the Ministry of Education. It is rather hosted by the Ministry of Gender and Social Protection, but then Education, Health, and Agric all serve on the committee. So it is possible, following the model that Elisabeth talked about having food rations for children. In the northern part of Ghana, some children are actually given food rations to encourage them to school. But then these are children in school. And since schools already have the data of the children and those who are already fed, it should be possible to have a model where the food rations are given to the children or given to the children through their parents, so that, because all schools have data on parents or wards, guardians who have children in the school. So it should be possible to have a model like that, especially where you already have a multi-sectorial committee that is running the program. Thank you.
I would just add that I think the emergency has made us collaborate, and that we have realized also that it's easier probably to collaborate now because we have just taken out so many barriers that we have placed before for interagency or interinstitutional collaboration. And now that we have the emergency, we realize, oh, we could have done this differently before. So definitely in the case of school feeding programs here is we started working with FAO to improve the school feeding program in Panama, and our colleagues in Haiti are doing that with the World Food Program, and in Guatemala it's another program that's working with school feeding also, where there's several agencies including the ministries of agriculture for local sourcing of produce, for local sourcing of food supplies from local farmers, which is sometimes goes counter to what we've been doing in school feeding programs, is like this big purchases from companies. That has not been easy during the pandemic. So agencies are collaborating more. And for that, to that point, I would say that in education too, we can collaborate more, and that this pandemic has offered us the opportunity to collaborate more. We see it, for example, with programs that come from other countries that are being adapted to different realities very quickly, because we need to come up with solutions for the different populations. So it's one area where I think we have learned that we can collaborate more, and hopefully after the pandemic, we'll find the resources and the means to foster that collaboration that probably before wasn't as easy.
Okay, great. Thank you. So we're almost out of time, but I'll ask one question, also informed by our chat, about, I think, over the past several years, we've seen an incredible increase in interest and attention to early childhood development, which is really exciting, but still sometimes, as was mentioned in the chat, in a general survey, it won't include questions related to early childhood development, and so I think that's my question for any of the panelists right now. And thinking about this current period, have you seen early childhood really be prioritized during the pandemic response, or have you seen it, sort of be more of a secondary concern if it's included on data collection efforts, or how do we get the information we need in order to act in this field? So any general comments, and then we can use this to wrap up as well about where you see us needing to move forward.
In Latin America, we're seeing that many countries many ministers of education are really prioritizing early childhood also. It's not just the higher grades, but they've been trying to provide distance education also in the early years. It's of course much more difficult because you can't, even for kids that are middle class, have access to computers. It's like a preschooler, it's harder to just put in front of a computer. What the IDB has been doing and collaborating with ministries is that we have purchased the programming from Sesame Street, and both in Spanish and in English, because those are tested. There's actually been rigorously evaluated, including one evaluation that we completed in January this year in Colombia. And we know that the Sesame Street materials, it actually improves cognitive development. We know that it can help with socio-emotional skills. We even, in the randomized control trial we just completed in Colombia, we saw that it actually impacts the development of gender stereotypes about STEM in early childhood, which so we know that the Sesame Street materials are really, really rigorous, and we then are collaborating with ministries of education throughout the region to transmit these through television throughout the region, and it's already being distributed in, I think, 15 countries now, and there are the other we're hoping to get all 26 member countries on board, so that they can then get some type of content out to preschoolers. But so the ministries of education are trying, but of course it's like additional challenges when it comes to preschool education. Another line of action that the IDB has supported together with ministries of education from many countries is to work with nudges. And we're actually doing this with IPA also, where it's like you send the information to parents on how they can continue early learning from home to different age groups of children, and then stimulate child development during lockdown, even though no early stimulation centers are open, that they can continue at home. So then that's kind of RCTs, but with nudging to parents. So those are two lines of action that the IDB is supporting. But yeah, generally ministries are really trying.
Okay, great. So thank you so much. We are unfortunately out of time, but I think that Emma, that was a wonderful closing comment in recognizing the importance of parents, the challenges around access, using alternative platforms such as media, so radio, television. I think direct text messaging is an area that IPA is definitely really interested in a number of different contexts. So I just want to thank all of our panelists so much for being with us today. This was a really wonderful experience, I think, to hear about some rigorous research that's going on. Just to address a few comments in the question and answer as well. So both of these studies are profiled on IPA's website, so you can get more information. And the paper that Beta mentioned is also available there. It's open access, so it's freely available to everyone. And the Panama study, I think, is still ongoing, but we look forward to receiving more write-ups about that as well. So I encourage you to look in to some of those details. And I'd just like to thank you everyone again for joining us. And we look forward to the next webinar in IPA series here.